Hey guys, welcome back to the channel. This is Nursing with Ray. I'm Ray truly, and if you're new to the channel, welcome. Thank you for clicking on this video. Please make sure that you subscribe down below, that you like the video, and that you share and leave a comment. And if you're not new to the channel, thank you for coming back. I appreciate you guys. I know it's been a while since I've uploaded, but thanks for sticking around. So in today's video, as you can tell by the title, I'm going to be sharing my clinical experience with you guys. So if you are new to the channel, hi, my name is Rihanna. I am a sophomore nursing student here in Jamaica, and I just went on my first clinical last year in November. So I went on my first clinical rotation in November. The clinical rotation was 5 weeks long. It was from November 1st until December 3rd. So I asked you guys to send me some questions on the community tab here on YouTube, and you guys just asked me all the questions that you had about clinical. So anyways, without further rambling, I'm just going to get into the questions. So it's going to kind of be like a Q&A, but I'm also going to be sharing a few little stories and stuff like that that happened on clinical. And just a disclaimer, no patient confidentiality rights will be breached in the making of this video. I won't be sharing any patient names or certain information that you know that's not supposed to be shared. I'm just going to be kind of vague. So yeah, let's get into it. So if you see me looking down, I'm actually looking at this flashcard that I have here with the questions written on them. So I'm just going to start. Okay, so the first question is, what are some things you need to bring with you on clinical? Okay, things that you need to bring with you on clinical are going to be basically the same equipment that you've been using in lab leading up to clinical. So that's going to be your stethoscope. That's going to be your blood pressure machine. That's going to be your pen lights. That's going to be your thermometer. It's going to be your, what do you call that? Your reflex hammer. It's going to be all those little equipment that you've been using, your skin markers, things like that. All the equipment that you've been using, you're going to need to bring that on clinical with you. And also, because we learn in labs to take pulses manually, that's really what we're supposed to do. But to be honest, on clinical, nobody ain't got time for that. So I would suggest you buy a pulse oximeter as well, so that you can just pop that onto your patient's finger and check their oxygen saturation and their pulse. Well, I mean, you would have needed it anyway to check the oxygen saturation. So if you can get it before clinical, that would be ideal. I didn't have one this clinical, and I kept having to like borrow the nurses and stuff, and it was kind of like annoying. So definitely for next clinical, I'm going to be getting my own. So different from your equipment that you already know about in lab, it's COVID. So you're going to need some PPE. A lot of times the hospital will provide certain types of PPE, but you know, you're going to need to bring your own mask. So make sure that you have your mask. Make sure that you have alcohol and sanitizer to, you know, sanitize your hands and stuff like that throughout the day. Wash your hands. Sometimes I actually wash. Don't just like use sanitizer all the time. So, you know, washing is more efficient. What else do you need to bring? Depending on what your rotation is, if you're going to be like going into the OR or a certain place like that, if you can get like, you know, like surgical gowns and like the booties to put over your feet and like head caps and things like that. But they will definitely tell you what you're going to need before clinical starts, so you don't have to really worry about that. The next question is, what are some tips on doing your best on clinical? Okay, so tips on doing your best at clinical is, number one, do not shy away. I know it's very easy to shy away from doing certain things when you're on clinical, but it's really, really vital that you don't. Especially when it's your first clinical, because you're just kind of getting acclimated to it. You're kind of scared. You're not really knowing what's like going on, but definitely don't shy away, because when you try to go out there, put yourself out there and do more things, you are definitely going to learn more. And when nurses see that you're actually like proactive and you actually want to learn, they will definitely help you way more than if you shy away. So first thing I would definitely say is don't shy away. Try to do as many things as you can. And I mean, you're going to have your objectives that you need to accomplish, so you're going to have things that you're going to need to do. But even if certain things are not on your objective list, still make sure that you go and observe them and assist in any way that you can. Ask questions. Ask questions on things that you want to know, things that you're not sure about. You know, if a nurse sends you to do certain thing and you're not really sure about it, don't just go and do it. Make sure that you ask questions first, because it's better for you to ask a question than for them to say, oh, she doesn't know that or he doesn't know that. That's fine. It's better you do that than you go and try to do something and you don't necessarily know how to do it and then you end up hurting somebody. That's another tip. Third tip is do not do anything that you were not taught in lab. Yeah, don't do it. I know a lot of times some of the nurses are going to want to say, oh, come let me teach you how to do this. That's fine. You can go and they can show you, but never actually do it. Like, you can get into a lot of trouble for doing things that it's not, like, you're not at the level to do just yet. So anything that you were not taught, don't do it. Please. I'm begging you guys. Like, don't. Another tip for doing your best on clinical is to just, like, what would I say, like, even though you're not, maybe not at a certain level to do a certain thing just yet, it doesn't mean that you can't acquire the knowledge. So maybe it's not time for you on your first clinical. I doubt you'll be placing NGs, so it doesn't mean that you can't go and observe a nurse inserting an NG tube. Like, you can go and you can watch and take notes, so that when your next clinical rotation comes around and you're in lab, you'll already be ahead of the game and you'll already know what it's like, what are the steps and stuff when inserting an NG tube, for example. So even though you're not at that level, it doesn't mean that you cannot go and observe a procedure, and it doesn't mean that you can't take notes and, like, research and stuff of that sort. Okay, the next question. Do you think you were prepared enough before going into clinicals? Now, this is a yes and a no, and I'm going to tell you why. Yes, because obviously everything that we needed to know for this clinical rotation, we were taught in the lab setting. So, yes, I was prepared in that sense. But when it comes to other aspects of the hospital, I don't think I was really ready for it, in the sense that there's a big emotional burden that comes with being in the hospital. You get exposed to death. I was really exposed to death over the clinical rotation, and it really kind of, like, opened my eyes to certain things that I don't think I was really ready for. The way death is so, like, prominent everywhere. Like, I've seen so many people die. I don't want to sound morbid, but I've seen so many people die in those 5 weeks. It's crazy. And just, like, the hospital environment in itself, I don't think I was, like, adequately prepared for that, because I've only been to a hospital, like, a few times, because one time my mom was hospitalized and I went to visit her a couple times, but I wasn't, like, used to the hospital environment like that. And now that you're a student nurse, you have access to go into different areas of the hospital that you don't necessarily have access to when you're just a visitor, right? So it was, like, a lot of things that I wasn't necessarily prepared for in that sense. Okay, so the next question is, what was your first day like on clinicals? Okay, so my first day, it actually kind of started out not the way I would have liked. I forgot my hat. So, you know, we have to wear our uniforms, we have to wear our apron, which is the white thing that we wear over our uniforms, and then we have to wear our little nursing hat when we got the cap. And I forgot my cap on the first day, and it was crazy because when I was on my way there, I was going with my batchmate on campus or whatever, on campus at the hospital, and I was like, oh my god, I forgot my hat when I was, like, more than halfway to the hospital. So, like, I couldn't turn back, because if I turned back, I would have been extremely late, and that is definitely not a good look for the first day. So I was talking to my friend, and she was like, oh my god, because they said that if you don't have your hat, like, you're gonna have to, like, go home. They're gonna send you home. And I'm like, what? Girl, I was scared out of my mind. I was like, are these people really gonna send me home? But anyways, we got to the hospital. We weren't really sure, like, where to go or whatever. It was my first time at the hospital that I was assigned, and I saw my instructor, and I was like, Miss, I forgot my hat. And she was like, oh my god, like, how'd you do that and whatever. She was like, I'll give you a pass for the first day or whatever. I was like, thank you, Jesus. So that was the first thing that kind of, like, threw me off for the day. I was like, oh my god, like, it's the first day and I'm already forgetting things. But anyways, we knew what ward we were assigned to, because we switch wards every week, so we spend a week on each of the wards. So I was assigned to male medical that first week with my batchmate, and that that first week was actually my best week out of the 5 weeks. That ward was the ward that I actually enjoyed the most. Um, and I can remember the first like patient that we encountered had an upper GI bleed, and we were doing a bed bath with the PCA, and the patient had like dark bloody stool, and it had like a really foul odor, and that was like our first encounter, and I was like, oh my god. Unfortunately, that patient ended up passing when we came for our shift the next day. He wasn't there, and he passed. But anyway, my first day was good. The nurses that was on that ward the day, a lot of them were NCU pass students, so they were really nice to us. They helped us, taught us a lot of stuff, and they were just really fun to be around. So I really ended up enjoying my first day. Okay, the next question is, what was your most memorable clinical experience? Okay, so my most memorable clinical experience was actually when we got to assist the nurses with picking maggots out of a patient's foot. So yeah, we had a patient. I can't really go into details, but patient was diabetic and had a wound on the foot, and the patient started to report that they were feeling like biting, like they were being bitten, and patient was taken to the treatment room, and when they took the bandages off, there were just maggots everywhere, like everywhere. Man, to say no, like I mean a lot of them. And so it was me and two of my other batchmates, Shanique and Owen, and we like went into the room. Like I was going into the room, and I had to like back out like instantly because the stench just hit me like this. Mentally say the stench licked me. I had to back out, and then Shanique, she came to me and she gave me like this napkin with eucalyptus oil on it, so we could just kind of like smell it before you went into the room, because the smell was really bad, and you know that you don't really want to be in the room and like skin up your face and somebody to make the patient feel bad. So you really had to just grin and bear it, really. And so the nurses, they were removing the maggots from the wound, and we were like going back and forth. I was grabbing surgical blades. They were sending us to get forceps, and we were like shining like a pen light and stuff so they could see the wound better. And I'm telling you, the foot, like the infected area, like you could see the patient's bones, like in his foot, to how bad it was. And there were so many maggots. We had this big kidney dish, like the one that they used to do dressings and stuff, and the kidney dish was almost filled with maggots, and they're fat. But anyways, they picked them out, and then they did the dressing and everything like that. So I would have to say that was definitely my most memorable clinical experience. I know a lot of people don't really do well with maggots and things like that, but it wasn't really the maggots that was the hard part for me. It was the smell. But that was definitely my most memorable clinical experience. Okay, the next question is, did you face any problems with any nurse on clinical? Okay. So, clinical, it's like you're going to meet a lot of different people. You're going to meet a lot of nurses, doctors, PCAs, everybody, right? And everybody has a different personality, and that's something that we just have to deal with in life, period, right? So some of the nurses, they are very welcoming to us. They try to take us under their wing. They try to show us the ropes. They try to just take us everywhere with them. And then some of the nurses aren't really like that. Some of them, I feel like they kind of see us as a burden. Some of them, they don't really show us anything. They don't really like talk to us. They don't really interact with us like that, and that's fine. That's completely normal, because everybody has their own unique personality. But some of them actually there was instances of like reporting people. It was, some of them are just really not nice at all, if I'm being completely honest. some of the nurses really aren't nice. I didn't necessarily have any problem with any of them, but I was accused of something at one point that it just really hurt me. I wasn't accused by a nurse though. I was actually accused by a janitor, and it was not the greatest experience, and it really kind of made me like want to not be on clinical anymore. But I kind of overcame that. Next question is, um, what type of patients did you encounter on your clinical rotation? Okay, so you encounter a lot of patients, and this is kind of what I really like about nursing and stuff. You get to meet a lot of people. You encounter patients from all different age ranges, from all different walks of life, with all different types of conditions, um, a lot of different temperaments. So I've had patients that are super duper nice, and I've had patients who've kind of been a little bit rude to me. But I know some of my batchmates have had experiences where patients outright tell them that they don't want no student nurse to do nothing for them. I've had batchmates tell me that patients have completely cussed them out, but I haven't had that experience, thankfully. Um, and in my experience, the male patients are usually the ones that are more nicer. They're usually nice to us. They'll usually allow us to assess them and to do a lot of different things with them. Whereas I've noticed that kind of the female patients, they're a little bit more cranky. They're a little bit more like, okay, like But I've had female patients too that are really sweet. Like we had like heart to hearts and we talk about stuff. Because a lot of times, like I have patients who, they're like way older than me, and I'm like they're taking care of them and stuff, and they're like, how old are you? And I'm like, I'm 19, and they're like, what? So you're gonna have those moments where you're gonna really bond with your patients, and then you're gonna have some patients who just want you to get the hell away from them, and that's fine. We've had patients who allowed like all of us, all the nursing students, all of us to come and assess them and things like that, and just really receptive and all those things. So, and I had a few patients that I was really fond of. There's really, really good aspects to it when you can care for patients and you see them recover, and when they get discharged. I remember the happiest discharge I had seen was the patient that allowed us student nurses to assess him and everything, and we would always talk about God because patient was a Christian, and we just had a lot of heart to heart, and we looked out for the patient and everything. And so when the patient got discharged, we were so happy. It was like finally he could go home to his wife, so there's gonna be highs, there's gonna be lows, but overall I can definitely say that I enjoyed my clinical rotation. I learned a lot of things, and I'm actually really excited for the next clinical coming, because now we're going to be able to do a lot more for our patients. Because the first clinical, we were limited in what we could do. So mostly we were doing vitals, we were doing like bed baths, we were doing urinalysis, we were doing little things like that. Yeah, and that's it for the questions that I have. I hope you guys really enjoyed this video. If you did, please remember to leave a like on the video, because that really helps the channel to grow. And please share the video as well if there's any nursing student out there that you think would be interested, and leave a comment down below as well. If you're not already following me on Instagram, I'm gonna leave the link in my description down below. My Instagram is @nursingwithray. I'll pop it up on the screen too. So yeah, I'll see you guys in the next video. Bye.